today are to describe a holistic definition of health that aligns with the World Health Organization's definition, define the weight-centered approach to health, state 3 negative health consequences of the weight-centered approach. Hopefully you'll be able to define a weight-inclusive approach to health after the talk, and also be able to identify 3 weight-inclusive practices that you can adopt today. So when we think first about health, health is defined in actually various different ways. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not just merely the absence of disease or infirmity. I think sometimes when we talk about health, folks can just have, I've heard from patients and clients, that it's just, am I well or not well, sick or healthy, free from disease. And so other public health organizations have said, health is actually properly defined when we focus on the interactions of humans with their environments and among themselves. And so a nice, I think, more holistic definition of health or healthy is that a person has the physical, mental, and spiritual capacity to live, work, and interact joyfully with other human beings. And it's important that we think about this aspect of health as we move forward in the talk. And so applying health to with a more holistic definition and using the socio-ecological model, you can see that a complete definition of health and health behavior change includes several different layers or components at which an individual may interact with their environment and with others. And so according to the socio-ecological model, we can have the largest impact on health behavior change at the structure or policy level. And the smallest impact is actually made at the individual level. And so individuals may have control over certain lifestyle and behavioral characteristics, such as those that are listed here, but individuals don't have control over direct control over structures, policies, and communities, for example. And so this is really important as we start to think about how in our country we think about weight and health. And so if we think about that, and you all pause for a second, and just think about in your own experience when you think about weight or how you've been talked to about your weight or folks that you love their weight. I think that you might agree that in the US today, there's a very weight-centered approach to health. And what that means is that there's this focus on weight change as being the top priority for achieving health. And really a focus on changing those individual characteristics that I just talked about, diet, physical activity, and lifestyle habits, without taking into account the other levels or components of interaction of health behavior change. And a weight-centered model is also going to assert that the individual is completely responsible for their ability to control their body weight and health, because again, this weight-centered approach says that weight is the main driving factor of health. So when we think about health from a weight-centered approach, it typically ignores and really devalues that whole mental and spiritual capacity, that interaction with other human beings and the environment that I talked about before. So this is just a nice visual that I like to include. If we go back to that socio-ecological model of health, really if in a weight-centered approach, it's all about the individual. And so if we can get individuals to change and specifically change their weight, that's going to improve their health. And we can see from the socio-ecological model, that's false thinking, right? We need to incorporate all of those other factors. What's happened is now over the past 4 decades, and especially with this whole emphasis on obesity and the obesity epidemic, we've started to see that there's consequences of using this weight-centered approach. And I've listed the 4 consequences here that I'm going to talk about. What we've started to see in the research is actually there's a failure of these weight loss interventions to work in the long term. There's also some real dangers of weight cycling that results from a weight-centered approach. We've seen in the research that there's an increased risk of eating disorders that is associated with trying to maintain a certain weight. And there's this heightened weight stigma. So I want to jump right into the research when we talk about failure of weight loss interventions. So in a recent meta-analysis of 29 studies on structured weight loss programs, the findings were that participants of these programs typically regained 77% of the initial weight that they lost after 5 years. An additional study reported that most of the weight is regained within a 2-year period, and by 5 years, the majority of people regain all of the weight that they lost back as part of these weight loss intervention programs. And then thinking a little bit more into earlier life, there's some research that has shown that chronic dieting that starts in adolescence and continues into adulthood actually leads to weight regain plus additional weight gain, also known as weight cycling, which I'm going to talk about in a second. And this chronic dieting in adolescence has been linked to increased morbidity and mortality and disordered eating patterns. And so what this means is if these interventions aren't working, I think that we are forced to think about different ways to approach the problem and moving away from this weight-centered approach. And then to talk a little bit more about weight cycling. So what I was describing is that folks tend to lose weight and then gain weight back. And I want to just illustrate the cycle that happens. So when someone's going through one of these diet phases, there's restriction of either calories, sometimes it's a whole food group, like no grains, or a whole macronutrient, like no carbs. And so with that restriction, there's typically weight loss. And the person is in a state of deprivation, and there may be more weight loss. But eventually, with these diets that are not sustainable, the person will fall off and typically overeat, and especially overconsume those foods that they haven't been eating. And I don't even really like to use the term overeat. I like to use the term compensation, because our body is designed to keep us alive. So if we've been in a state of restriction, as soon as we are no longer in that state, the body wants to compensate for what's happened and prepare for a future restriction that might happen. And so as part of that compensation, weight is regained, like I talked about before. But at an internal level, the person is feeling very ashamed. They may gain more weight, they may feel and think negative thoughts about themselves, and then they start the cycle all over again. So if you're someone that's listening, or you know people in your life who have experienced this, especially related to chronic dieting, where they just gain and lose and gain and lose and gain and lose, you have probably seen the effects that it has on your loved ones or in your own life. And what the research is showing now is there's actually adverse health outcomes that are associated with this weight cycling. Higher mortality rates, higher risk of osteoporotic fractures, gallstone attacks, loss of muscle mass, hypertension, chronic inflammation, and some types of cancers. And so again, this calls into question, I think, if we think about that weight-centered approach, and a lot of the research that has shown that living with obesity is associated with chronic disease, it could be that because we're not accounting for weight cycling and weight cycling's association with these adverse health factors, there may be some confounding of these associations of obesity with disease that we've seen in the literature over the past few decades. Another problem with this weight-centered approach is research has shown that it's associated with increased risk of eating disorders. Individuals who attempt intentional weight loss are at a higher risk of binge eating disorder, bulimia nervosa, and disordered eating behaviors. For example, they will binge eat food and sometimes use laxatives or purge or excessively exercise to compensate for the calories consumed. And so I just want to take a second to talk about disordered eating behaviors, which are different from saying that someone is living with an eating disorder. So actually, many of us may engage in a disordered eating behavior. I'll give you an example, and some people may not like to hear this, but if you've ever not eaten all day in preparation for a large holiday meal, some people do this in preparation for Thanksgiving dinner, for example, not eating and storing up and not listening to your hunger cues and waiting till you have that big meal, that's actually a disordered eating behavior. Doesn't mean you have an eating disorder. It just means that it is a behavior that is not aligned with a healthy relationship with food and body. And so if somebody has a cluster of those factors, then they may present with a cluster of factors that would align with an eating disorder. But just having one of those behaviors, it doesn't necessarily mean you're living with an eating disorder. So last consequence of this weight-centered approach is heightened weight stigma. Weight stigma is really the result of idolizing thinness in women, leanness in men, and weight loss as healthy. And I'm just going to sit for a second, because if we think about that, it's pretty clear that in our society in general, this is a common practice, right? We see it all the time in television, on social media, in different ways in our society, that there's a certain way that women that are beautiful should look, there's a certain way that men are attractive should look, and weight loss is really the ultimate goal. That's healthy, no matter how you've lost weight. And I can tell you, as a dietitian who's worked in clinical practice and worked with patients who've lost weight due to substance use disorder, due to chronic illness, due to other reasons, weight loss in and of itself is not always healthy, and I'm sure many of you know that. However, I have also had patients sit in my chair that have lost a great deal of weight related to illness and said to me, I don't want to gain that weight back. Whatever you tell me, just help me to not gain that weight back. And it's really sad, actually, but I think it speaks to this kind of idolization of weight loss in our society. So weight stigma is also sometimes called weight bias. You may hear me call it weight bias a little bit as I continue in the presentation, but what it is it's negative weight-related attitudes and beliefs towards individuals at a higher weight. And this will promote stereotyping, rejection, prejudice, and discrimination. And really, it's weight discrimination is what it is. So what are some behaviors that perpetuate weight stigma? Repeated weight-related teasing, bullying, harassment, violence, hostility, ostracism, pressure to lose weight or to be thin, and then weight-related microaggressions. And so I'll give you a good example of a microaggression. Do you know that when folks go into a primary care visit, if you're living in a larger body, specifically a BMI that is greater than 30, healthcare providers are prompted to recommend weight loss. That's only with folks that are in a larger body, again, with that BMI over 30. So folks that are in thinner bodies may come in for the same thing. Let's say it's a headache. So they come in, they get treated for their headache. There's no mention of weight loss. But a person in a larger body, immediately there's going to be that recommendation on weight loss, and the doctor should be giving them those type of, should be giving that type of guidance. And so that's a weight-related microaggression if you come in for a headache and the focus is on your weight. Other ways that, well, I'll go on to explain some other kind of weight-related microaggressions in a moment. So where does weight stigma come from? It's found in many different settings. The research shows that weight stigma is occurring in school settings, from peers, teachers, and staff, in public health initiatives, in workplace settings, from coworkers, supervisors, employees, friends, or employers, friends, and loved ones, and in healthcare environments by healthcare professionals. And there's actually quite a good deal of research, I'm in a little trouble here, in the healthcare environment. And so one study of women that were classified as overweight or obese actually reported that they experienced weight bias. 69% of these women reported that they experienced weight bias or stigma by a physician. 46% of the women reported they experienced weight bias from a nurse, 37% from dietitians, and 21% from other health professionals. And it's been cited in the literature that even professionals that treat obesity and eating disorders have been reported to exhibit weight bias and stigma towards their patients. So let's talk a little bit more about what this weight stigma in healthcare looks like. It's attitudes and comments from providers. It could even be facial expressions like eye rolls. There's some published reports that providers have said that they do feel like they don't want to touch or engage with someone who's living with obesity. Negative assumptions and stereotypes, like immediately looking at a person in a larger body and just automatically assuming that they don't work out, that they don't eat fruits and vegetables. Other judgments that are weight related. Inadequate medical equipment, so not having blood pressure cuffs that are large enough, not having speculums that are large enough, not having hospital gowns that are large enough, not having scales that will read up to the weight that the patient may actually be living with. The office environment could be stigmatizing. Here I have some a picture of different magazines. And if you've ever gone into a doctor's office where they have InStyle and GQ and Cosmo, all of this literature that's perpetuating this kind of thin fit ideal can be stigmatizing. And that would be also an example of a microaggression, that it's not a direct statement that something's wrong with you, but it's implying that being thin, being fit is better. And so that's kind of the message that is given. And then also weighing procedures, is weighing really necessary? Again, if someone comes in for an earache or a headache, why are we asking to take their weight? That is a question that I think needs to be asked. And I've already mentioned that another form of weight stigma is that in preventative care, that people in thin bodies are often given preventative care measures right away, whereas those in larger bodies typically have to deal with weight loss recommendations before any other care is provided. So what does weight stigma sound like? It sounds like saying things like, you look like you lost weight. You look like you gained weight. He must have skipped leg day. Must be nice to be so thin. She would be beautiful if she just lost a few pounds. Why do you need to work out? You're skinny. I wish I had your problem. Don't you think you should lose a little weight first? Gosh, how many times have we heard that from our friends and loved ones? They don't want to go out and try something new until they've dropped some weight. They don't want to get married until they've dropped weight. They don't want to start this until they've dropped weight. They're not living their lives because of the shame and stigma that they feel about engaging in a full and happy life at a higher body weight. Things might perpetuate weight stigma. There's some thoughts and actions. So practicing fad diets can perpetuate weight stigma. If you are somebody who's doing that, or it's happening a lot, maybe in your office environment, that can perpetuate weight stigma, sending the message that we need to be on diets. Encouraging patients, family, and friends to diet can be stigmatizing. Regular weight checks, certainly daily weight checking has been associated with weight stigma. And then, as I've already mentioned a few times, when a patient comes into the office, if there's not really a medically necessary reason to weigh, that could be stigmatizing. Weight loss challenges are also a way to perpetuate weight stigma. Again, this idea that everybody needs to be losing weight, right? And then in office environments, not just in healthcare, but other office environments can perpetuate weight stigma. A common thing is just not having chairs that are large enough to accommodate folks that live in larger bodies, or having desks and chairs, that are too small for folks to sit comfortably. So what are some consequences of weight stigma? Who cares, right? What's the big deal? Well, actually, it's a huge deal, especially in healthcare, because weight stigma has been associated with decreased healthcare utilization. So what's happening is folks that are living in larger bodies that we say, and that we have this research that says, okay, at higher weights, you're at increased risk for these chronic conditions. But actually, because of weight stigma, folks are not wanting to go into the doctor and utilizing healthcare. Weight stigma has also been associated with greater risk of psychological consequences like depression, binge eating, poor body image, substance use, and exercise avoidance. I mean, I'm sure you can think about a gym environment where someone living in a larger body may not want to go into the gym because of the stigma and shame they might feel. And then if we think about it from a different vantage point, weight stigma has actually been associated with inequalities in wage, promotions, et cetera. And I can tell you in my private practice, I counseled at least one patient I can think of that it was very sad, that shared with me they had actually been denied a promotion and told specifically that it was related to weight. And the sad news is there's no weight discrimination policies in our country. So there's nothing that they could do to seek compensation for that. Other consequences of weight stigma. So a person may internalize this weight stigma and begin to adopt negative weight-based societal stereotypes and judge themselves based on these stereotypes. And so this promotes internal body shaming, body blaming, and appearance monitoring. And so there's this sense that if I could just get my body right, then my life would be happy. Right? So they start to really associate this negative body image with why things are not the way that they would like them to be in their life. And again, that's just not living in a in reality. So what is the solution here, right? I told you we're going to talk about shifting the conversation. And so what research is showing is that there's a different approach, a weight-inclusive approach to health that really can address these issues. So a weight-inclusive approach involves focusing on improving patients' relationships with food, removing moral judgments around food, building awareness of hunger and fullness cues, emphasizing emotional and physical wellness over the pursuit of a lower weight or size. So adding in that emotional and physical and spiritual component that we talked about earlier, and advocating for the removal of stigma experienced by persons who are living in larger bodies. So if we remove that stigma and allow them to live their best lives, right? So does a weight-inclusive approach work? Yes. Weight-inclusive approaches in the research have been shown to improve physical health outcomes like blood pressure, behavioral health outcomes like binge eating, and depression has been improved as part of weight-inclusive approaches. So what does it sound like to be weight-inclusive, and what might weight inclusion sound like? So language that is perceived as more sensitive, like speaking about folks living in larger bodies, as opposed to using other terms that might be more stigmatizing. Saying things like, you look healthy, you have a healthy glow, or you look happy, or just refraining from commenting on another person's body weight, shape, and size in general would be more inclusive. And then interrupting sizeism. So when we hear others participating in joking, judgments, or other stigmatizing behaviors, saying something about it and being an advocate for change. What other thoughts or actions might create a weight-inclusive environment? If we encourage our patients, our friends, family members, coworkers to be as healthy as they can at whatever size. So helping to remove that kind of barrier that folks will sometimes feel like, well, if I just lost weight, then I could do this. Well, why don't you just do it now and see how you feel engaging in those behaviors? Maybe that will improve your self-esteem instead of waiting to live life to its fullest at a certain body weight, shape, or size. Also, instead of focusing on weight change, either weight loss or weight gain, support others to make behavior changes, right? So we can make behavioral changes in nutrition, in physical activity, in our lifestyle, in our self-care. Losing weight is not a behavior that we can do, right? I can't just say, well, today I'm going to lose weight. It doesn't work that way. I can say today I'm going to walk a mile. Today I'm going to eat more fruits and vegetables. I'm going to get more rest. I'm going to drink more water. Those are behaviors. And those are things we can make changes in, but we can't, weight is not a behavior. So we need to shift away from focusing on that as the goal to what are the behaviors that we want to engage in. What are some other weight inclusive practices, and what does weight inclusion look like in practice? Typically, a weight inclusive paradigm is going to focus on eating for well-being, using things such as intuitive eating, which many of you may have heard about, where you're paying more attention to your hunger and fullness cues and more attention to your relationship to food and your thoughts about food, rather than a strict calorie restricted diet. And other food type plans might be that are part of a weight inclusive practice would be flexible. They're individualized and they're based on nutritional needs, medical needs, and also pleasure and socialization. They will emphasize adding in healthy foods such as fruits, vegetables, food sources of fiber, healthy fats, and complex carbs. And there'll be that emphasis on what can I add in as opposed to what do I take away. There's a focus on life-enhancing movement that includes physical activities that allow people of all sizes, abilities, and interests to participate. So I think another real area of thinking about behavior change and applying a weight-inclusive approach is really to physical activity. If you've ever been to a gym class, I know I've been to many over the course of my life, and I have never been to one that has allowed accommodations for someone in a wheelchair, for example. So I think as part of weight inclusive practice, we have to recognize that people have many different types of abilities and interests. And so it doesn't have to be the typical gym either. You know, seek out things that are enjoyable movement to the degree that you choose would be part of a weight inclusive practice. Maybe that's dancing, maybe that's walking. It allows people the flexibility to choose. And then another thing that can be part of weight inclusive practice is seeking out healthcare professionals that are competent and utilize these weight inclusive practices themselves. So there are many resources for finding those types of healthcare professionals, which I'll talk about in a moment. Another important thing to think about if we want to be more weight inclusive is to look within and identify our own biases and prejudices by practicing self-awareness. And we can ask ourselves questions like, how do I feel when I work with persons of different body sizes? Do I make assumptions regarding a person's character, intelligence, abilities, health status, or behaviors based solely on their weight? What stereotypes do I have about persons living with obesity? And how do those living with obesity feel when they leave my presence? So just going through and answering some of these questions on our own can give us insight into our own biases. We all have biases. It's not a good thing or a bad thing. It just is a reality. And so the only way we can become aware, and if we want to change those things, the only way we can do that is by these types of self-reflection. Excuse me. What else can we do? We can really look toward ways to free ourselves from weight obsession if we're living with that, or if it seems to come up in our environment. We can look towards ways to separate from that and get some detachment from that. We can look to media and advertising images with a more critical eye, recognizing that a lot of the things that we see out in society are really promoting this idealized diet culture where weight loss is the goal, and promoting that men should look a certain way and women should look a certain way. And we can be critical about that and recognize that that doesn't have to be our reality. And a lot of those images are actually altered. We can not let ourselves be duped by diet scams and recognize that, you know, these things that are promising, reduced belly fat and other basically scams that they sell, it's just not true and not going to be helpful. We can also think critically about weight loss programs and really think about what our goals are. Why would we engage in a weight loss program, and what is it promoting, and how would it bring value, or would it harm our lives? We can overcome our own negative body image. The truth is, if you're a human being, you're probably living with some type of negative body image, and in my practice and my experience, everyone could use to think about that a little bit more, and then practice weight inclusivity yourself. Another thing that's really important, if we think back to that socio-ecological model, is we can support health policies that work to end weight discrimination. As I said, currently there are no policies that prevent weight discrimination in the workplace, but we can be advocates of change for that. And certainly if you're in a position of power within your organization, you can think about some of those things that we've talked about today, like the office environment, making sure there's chairs that accommodate everyone, thinking about the imaging that's in waiting rooms and offices, and thinking about how to make your space a more inclusive space. And also maybe thinking about language that's used, and how there may be weight stigmatizing language that's being used, and how might you change that. So that's part of the second bullet point here, just personal practices that improve human well-being, including attention to physical, economical, social, spiritual, emotional, and other needs. So moving away from weight being the sole focus to really this more holistic approach that's supported by the socio-ecological model and other models of health behavior change. And finally, one of the more well-known weight inclusive paradigms is this health at every size approach. And so one thing you can do is learn more about and endorse the health at every size approach. Really what health at every size says is that we should value people and value them and meet them where they're at, and encourage them in adopting healthy behaviors in an inclusive way. It's a social justice movement that recognizes that everyone has different social characteristics, and that actually everyone has a different body weight, shape, and size, and that all of the characteristics that make us who we are, race, national origin, sexuality, disability status, that all of these are attributes. So health at every size says, how can we look at assets, right, and work from our assets? And it really is a paradigm that is looking to change structures and systems, because as I showed you on the very first slide today, there's only so much that individuals can do in making this change. We really have to come at this from a systemic level and think about how do we work our way up to policies that are going to support inclusive environments so that everyone can live their best life and be part of society. So in summary, I hope that you can leave this with some thoughts today about how health status is actually impacted by many factors beyond individual responsibility, that a weight-centered approach contributes to weight cycling, disordered eating, and heightened weight stigma, where a weight-inclusive approach acknowledges the social determinants of health and supports physical and mental health, and that you now have some ideas about how to practice weight inclusivity. Here are some suggested resources, the Health at Every Size website, and they used to have on that website a list of providers who were Health at Every Size aligned. I think that has changed now, but there are other organizations, and if you're interested in learning more about those, like there's the Weight Inclusive Nutrition and Dietetics group, there's Weight Inclusive Diabetes Care, there's other organizations that I could definitely connect you to. And with that, I say thank you. I have some references if you'd like to see them. My phone number and email address are there. I'm happy to connect with you if you'd like to talk more about this, and I appreciate your time.
Wonderful. Oh my gosh, Dr. Butler, there was such good information in this talk. I feel so pumped after hearing all of your great information you presented to us today. I want to turn it over if anyone has any questions for Dr. Butler. I had one that I wanted to just kind of start with, well, if anyone else is thinking about questions they have. But you mentioned that really at this time, we don't have a lot of weight inclusive policies that have been put into place. Is that something that you see changing? Is there hope on the horizon that we might, move towards, as a nation, a more weight inclusive environment?
Yeah, I mean, I definitely, the hope where there's hope, I have hope, and the folks that I am connected with, we have hope. I think you know how policy works, right? So we need to continue advocating for these weight inclusive interventions to show that we do see improvements in disordered eating, in mental health concerns, and in cardiometabolic health. I mean, there's some evidence that the weight inclusive practices can help normalize blood sugar among patients that are living with diabetes. So we have to get the science out there. And then I think we need to continue, especially within the profession of public health, just continue to educate people so they learn more about this and stop meeting it with such aversion. We don't have to be averse to weight inclusivity. It's not that we're saying we want folks to be unhealthy, that somehow we got this bad rap here, right? That's not the message at all. But I do think if we could get people can advocate at the policy level now. I think there's enough evidence to do that. It's just a matter of getting folks who are willing and capable the support that they need.
Mm-hmm. Wonderful. I have another question for you if there are no questions yet. I also, was thinking as you were talking, we're in January. This is kind of the time that, for a lot of people, they start thinking about, what kind of dieting can they do because of, compensation for the holidays or whatever that thinking is. And I'm just curious for you, what advice do you have or what do you tell your patients, when there's that kind of system in place, when we see that messaging everywhere?
Yeah, that's a great question. And what I would say to folks is, especially folks who participated in the yo-yo dieting and the weight loss and weight gain their whole entire life, is try something different. So don't go back to that new year, new you. Instead, focus on right now, at whatever body weight, shape, and size you're at. Participate in something that you normally wouldn't. instead of turning to that next diet like you've done so many times in the past, turn to a different behavior, health behavior. And maybe that is, instead of going into the gym again and starting some intense exercise routine, why don't you join a line dancing or something that you actually enjoy doing? So do something different. And that can be really difficult for folks that have this ingrained in them, that know you have to be on a diet, and either I'm dieting and losing weight or I'm binging and not doing anything at all. It's really kind of a world of extremism. So what I would say is find a middle ground. Don't go to either extreme. Like, let's find a middle ground behavior for you. And when working with people, that's what I really have to support them in, because there's that, like I said, ingrainment in their brains and their thoughts keeps telling them this is wrong, no, and we have to provide support. And so the other thing is to drop all the social media, since right now social media is so popular and powerful. A number one technique that I tell people is drop all those dieting social medias, all the fitness influencers, and get folks that are talking about healing disordered eating, healing body image, non-diet dietitians, and start following them so that you can get some support that way. Because it's definitely difficult to try to do that on your own with all the messages that we get from the systems and societal level.
Absolutely. I love so much that you highlighted that weight loss isn't a behavior. That was such a powerful moment for me in your talk of, really getting at what are behaviors, and let's focus on behaviors that we can, make a difference in, versus being so focused on trying to center weight loss as some kind of behavior when it really isn't.
Yeah, that is so important to me. And I think, like, no matter what side of the debate you stand on, if you're somebody that's like, I'm always going to do what we did, there's research, I'm not going to move from that, we still want to encourage health behaviors. So I don't understand why we can't just do that. We still want to encourage folks to have to participate in health behaviors, but to the extent they can. And I think that's the other thing that's unique about weight inclusive movements like Health at Every Size, because it's the first time where I've really heard people come together and go, there's some people who can't go to the gym for whatever reason. There's some people who've been living under systemic oppression their whole life, and so they cannot do these behaviors that we are recommending. Like, it's just not an equal playing field. And I think that for me was really a game changer when I started to go, this is an equity issue, really, and so I didn't go up there today. Today was just kind of the introduction light, version, but I would totally talk more about that in another like more in-depth talk.
I sure hope that we can have you back to talk even more about this topic, because I feel like it's one, you can hit from so many different perspectives.
Yeah, absolutely. And it's something I'm really passionate about. And I'm just, I'm really glad that I'm here and I have the opportunity to share with you all. And like I said, if people have other questions, you can always just email me too, if you feel more comfortable that way, or however I can be of service. I'm happy to do that.
I have a quick question if I can.
Yeah.
So I work with college students here at Texas State. I oversee a student org called Healthy Cats, where we do a lot of that individual wellness. But I individually was somebody who struggled with an eating disorder when I was a young person, and like when I was in elementary school, like all the way through college, until I took a class on eating disorders. And then I realized that I had struggled with an eating disorder all of my life. And so I think that as somebody who works in family and consumer sciences, I'm curious because a lot of this stuff is about like what we as adults can do to kind of like, change the way that we think about things, right? And that's, we have a lot more freedom and power to do that. But when you're a young person, especially when you're a kid, all of your well visits are your weight and how you're developing, and that on top of like having a parent who grew up in the 80s with a lot of the diet culture, right? So there was that like, oh, you're outside of this weight category, so now I have to put my 8-year-old on a diet. And so like, how do we ensure that as we're working with people who are young people, growing up in the society today that don't have a lot of that opportunity and power to make those choices for themselves, and may have adults around them pushing these not good health practices to manipulate their weight. What do we do to, I know that we can create that society and we can create that culture, but if we just continue to have generations of young people that we then have to have this conversation with when they're adults, how are we getting at changing that at a societal level? Or do you have any thoughts about that, or even data around how many adults report that when they're young, this was what happened to them?
Yeah, I love this. I think this is so important. We don't have good data that I'm aware of, but I can tell you that in my private practice and in the clinic that I worked in, every single person that I talked to, this started in childhood. I was a chubby kid. I was teased. I went to see a diet doctor when I was 8 years old. I mean, it started in childhood. And the whole thing too that I want to say, what first really attracted me to ending weight stigma is because one of the proponents says that when you weight cycle like this, you just keep gaining more and more and more weight. So if you start weight cycling when you're 8 years old, by the time you're 30, how much more weight on top of your set point have you gained, right? So I think that in and of itself is not the end goal where I'm at now today with weight inclusion, but that certainly attracted me in the beginning. And I think that's good enough to say, wait a minute, maybe we are harming these children. I think that it has to be for children, and I didn't work with children living with eating disorders because of a lot of what you described, because the parents are the number one contributing factor. So if we can't get parents on board, it's really difficult to heal the child's relationship. That's just a reality. If we don't have a parent who's fully committed, the child's only going to get so much out of it. So I think for children, we have to create the policy changes. We just have to, because if we then have policies in place that are different, and it's like they might still be receiving it at home, but when they go to the doctor, they're not getting stigmatized. And when they go to school, they're not getting stigmatized. And, some of the things that I'm really interested in doing is just putting up messaging, like in clinics. I'm trying to work with a clinic here in town, just putting up weight inclusive messages where we see folks in larger bodies eating and exercising and doing things and like living a full life. Like, does that help to make people feel more included? But I think for children, it has to be systemic. Like, there has to be big time public health initiatives that change.
Any other questions for Dr. Butler? Well, thank you so very much, Dr. Butler, for joining us today. This has been such an informative and helpful talk, and I hope that we have you back to go in even more depth like we were talking about, and just appreciate your time today. And thank you all for joining us and taking time out of your day to hear from Dr. Butler. We appreciate you being here.
Yeah, thank you all so much. Have a great rest of your week.
Have a wonderful day.
Bye.